We do record the beginning and ends of these meetings for folks who don't miss it, so I'm just turning that on. This is a place for capacity building and helping us to integrate your voices into our priorities. At this point, we plan to hold these meetings quarterly, and these are really meant to be for members and by members. So today, as we go along, if you have ideas for what else you want to see, please feel free to throw that in the chat or let our facilitators know. As I've sort of mentioned, today we're going to be going into some breakout rooms. These 5 groups were chosen back in the fall. We put out a notice to our membership about what groups they would first like to see. And we came back with these 5 categories: mental health, immigrants and refugees, CHW organizational leaders, group for Spanish-speaking promotoras, and a group for community health representatives, or CHRs. For those who don't know, community health representative is often the term used for community health workers who are working on tribal reservations. They often work for Indian Health Services or IHS. I now am going to invite one of our new staff members to come on and introduce herself and talk a little bit about our capacity building project here at NACHWA. Michaela, are you able to come off mute and introduce yourself?
Yes, thank you, Aurora. My name is Michaela. I am the new capacity building coordinator for NACHWA, and I want to introduce our CHW leaders to you today. So back in 2020, NACHWA recruited 10 CHW leaders from across the country. These leaders created group norms and assigned project roles, and they created a community of leaders in a virtual space. The leaders have created a national survey in English and in Spanish on CHW leadership and capacity, and we have experts working to disseminate, analyze, and report the data acquired through this survey. The leaders have also done a series of internal and external pieces of training in webinars and educational writings. And in short, we are investing in the authentic professional identities of community health workers across the country. We are uplifting the voice of culturally diverse public health professionals and providing education and career advancement through collaboratives and webinars. Our CHW leaders here today will be assisting in hosting a focus space where CHWs can come across sectors to engage with peers and share common themes. Thank you, Aurora, back to you.
Thank you, Michaela. Michaela is one of our many new staff members that you might see on the call today. We're so excited to get to welcome them and welcome them into this space. Before I move on, I also just want to give a shout out to the CHW leaders that Michaela is talking about. Many of them are here today. I see many of them in the chat right now. And all of the breakout rooms will be co-facilitated by a CHW leader. So you'll also get to meet some of them later on today. And now I also want to give a shout out to our guest facilitators for today. When we decided to have this learning collaborative be about mental health and self-care, we knew we wanted to invite some other guest facilitators and experts to come into our space and help give recommendations for resources and just invite them to share their expertise with us. For our CHW organizational leaders, Dr. Elena Ponce will be joining us from the CHW Coalition for Migrants and Refugees. The Promotora group will have Venice Caballos and Edna Hutcherson. The Immigrants and Refugees groups will have TNB Coach from Premier Health Advocates. Our mental health group is going to have someone from the National Latino Behavioral Health Association. And for our community health representatives, we have Monique Castro from the Indigenous Circle of Wellness. And with that, I'm actually going to hand it over to Monique to come off mute and lead us in a short grounding exercise before we launch into our breakout rooms.
Yeah, thank you. Hi, everyone. Greetings. So I wanted to go ahead and just get us kind of started and engaged with a little bit of a break, really. I'm sure many of us have been on Zoom all day, probably like already at the end of the day, kind of fatigued. And if not, like myself, I'm in Los Angeles. It's noon, but it feels like it's been a really long day already. So I invite you all to stand if you feel comfortable or able to. If not, you're totally okay with sitting down. But I do, you know, want us to stand up, get our blood flowing. And let's just start off with just some rolls of our shoulders. Just kind of like loosening up any tension that we might have in our shoulders, in our back. And we're gonna do 4 deep breaths together, and we're gonna include some hand motions. And that's gonna be bringing our hands from about our waist area with a deep inhale, bringing that up. And exhale. Another deep inhale. And exhale. 2 more. Inhale. And exhale. Just noticing any tension you might have in your body. We're gonna use this last breath together to release anything that's still kind of lingering. And exhale. Okay, I think we're all set. Thank you.
Thank you very much, Monique. I don't know about everyone else on the call, but that was definitely what I needed right now. Before we launch in, let me just get the slides back up. Before we talk about our breakout rooms, I just want to take a minute to talk about some of our group norms. We want to encourage folks to be listening with empathy and have a learning mindset about what others have to say, to both take space, this is a space for you, but also make space for others. Embrace a safe space. What is said here stays here. These, when we go into breakout rooms, nothing is recorded. That is just what for the group to be together and to speak. We want to be cognizant of the power and privileges that different people hold, and we want folks to be able to bring their whole selves. You know, this can be a casual meeting. Things happen, your kids come in, you might have dogs or cats making noise in the background, and that is all welcomed. So once again, today we're going to be focusing on self-care and your mental health. Our facilitators are going to be leading us through some of these questions. These are some of the guiding questions that we're going to start with, such as what is supporting your wellness right now? What does self-care mean for you? What are you feeling you need more of, or what do you need more support with? And then other questions about how your culture might be affecting your work life, or how to notice when you're in distress. So right now, I am gonna open up into our 5 breakout rooms. Give me 1 second. Hopefully everyone will be able to have that pop up on your screen. If not, you might have to go down to your 3 bubbles and click on breakout rooms and select a breakout room. I hope everyone enjoyed their breakout rooms. And we are now going to spend a few minutes. I know some folks probably want to know what other rooms discussed. So we'd like to take a couple minutes before we sort of wrap up to give people the opportunity to share out. Would I have someone from the organizational leaders group that would like to come and share? Nikki, are you back with us already?
Hey, I'm back. Yeah, sure. So we had a really great discussion in the CHW organizational leader breakout room. We talked a lot about what self-care means to us, and we talked about how self-care means seeing ourselves healthy, and how self-care can sometimes mean a reset and going back to what we need to be and where we need to be. Folks share some suggestions around you know, incorporating music, meditation, how those things are helpful. And we had some really fruitful conversations around how our culture plays a part in self-care including that imposter syndrome is one that can come from Western civilization and society. Colonizer values, how that can be detrimental, and even just some issues with our identity and feeling like we need to fit in a box. I think what we really came away with is that we're all worth it as CHW organizational leaders. And we didn't say this in the room, but we can't pour from an empty cup. So I definitely just wanted to lift that up in this space. Thanks.
Thank you so much, Nikki, for sharing that. I'm just capturing that last quote because I think it's so excellent. Lucia, would you mind coming and sharing what we talked about in the Promotora group?
Sure. So same thing, same themes, but one of the things that we discussed that kept coming up was not only looking into meditation, eating healthy, certain things that take us away from focusing on, what has gone wrong during the day or all the work that we're doing, but also our faith. So spirituality and faith was really, really important. How stress manifests in your body, right? Like, what are some of the ways that you can, your stress, like physical manifestation, and someone shared something related to how that has, impacted their bodies and how they know that's happening. We also sort of laughed at, telenovelas for us and using that as an escape, right, from reality, and Turkish soap operas was mentioned. And so I think one of the biggest pieces that we talked about was that for Latinx, or at least for our group, Promotoras de Salud, is bringing it back and utilizing other means to talk about behavioral health services. That is not your typical, right? It's like you have to get creative on how to incorporate those into not only our patients, but also for ourselves. And so I think it was a great conversation. Thank you for all of those who participated.
Yes, thank you, Lucia, and thank you. It was such a great conversation. Lucy, would you be able to share a little bit about what folks talked about in the immigrant and refugee group?
Sure, and we talked about so much. TNB, if you'd like to come in later to add on any points. We started off with, we really focused on the population that we serve, so the immigrant refugee population, and trying to really dig deeper into their self-care. And so we talked a lot about how the communities that we're serving have a lot of fear, anxiety, trauma from their lived experiences, and how for us as CHWs, how we feel a responsibility to help reassure these communities that they are safe, that we're able to provide a safety for them, and making them have hospitality, be hospitable to people and make them feel welcomed. And so this sense of responsibility to ensure this support and safety, I think for us, it can cause a lot of burnt out, or sometimes even guilt because we feel burnt out. And so for us, us working with the communities who are also, stressed, brings us stress as well, but we feel this responsibility to keep moving forward, even though we have these feelings of stress or burnt out or feeling overwhelmed. Something that someone said in the group that I really liked was empathy doesn't know a language. And so because we work with a lot of different communities that, come from different lived experiences, languages, countries, sometimes we can't connect to them fully in a way that we can with people from our own culture. But again, because of the work that we do, empathy doesn't know a language, and we're still trying to do that work, and on or off the clock as well. So even at work, and then we're off work, we're still doing the work because it's something that is so embedded in our own lived experiences as someone who is from that community. So we kind of talked a lot about just kind of really sharing those experiences that we're feeling. Some of the ways that people were taking time to self-care. We talked about exercise being really important, eating correctly, sleeping, and then something that was also brought up was being vulnerable with the the people that we're working with, but also like our supervisors, to allow them to know like how we are feeling. I think sometimes we aren't aware that we are overwhelmed because it's just so ingrained in the work that we do. I think the hustle and grind, it just feels like something we have to do. So really being vulnerable with like what our health is looking like, and having other people also help us be accountable for how we're feeling. And then the last thing we talked about, and there's just so much, but the last thing we talked about was how we can get more support or feel more supported by our organizations or by NACHWA. We talked about language support, because we are working with so many different communities. Like, how can we have more language support so that we can feel more connected to the groups that we're working with. And then also in terms of mental health for the communities that we're serving, because they're experiencing lots of different types of stress, anxiety, and trauma. How can we ensure that the types of mental health resources we're providing for them are culturally affirming? So if someone is of different cultures, are we ensuring that we're providing the correct type of mental health resource for that specific community that's going to be affirming for them? And yeah.
Thank you so much, Lucy. I'm actually going to stop sharing so we can see each other as we're sharing out. But thank you very much for sharing. And Monique, would you mind sharing what the community health representatives talked about in their group?
Yeah, absolutely. And if I miss anything, folks, feel free to chime in. I know Josie was taking some notes as well. So a lot of the themes similar to what folks have already shared. And we talked about boundaries. I think one was like a big one that kind of came up around boundaries and how do we honor our boundaries, and how to create those boundaries. The other thing that we had mentioned, and folks shared like various things that are helping them with their self-care and helping with support of their wellness, is like journaling, taking time, like solitude time for yourself, changing kind of like the environment that you're in as well. Trying to think of a few other things that folks were sharing. Josie, would you mind chiming in? I wasn't prepared to share all the things, so my mind was like kind of blank right now.
Sure. Yeah, they share a lot of different things, especially for self-care, or what are they doing right now that's helping them. You're right, the journaling, separation from the rest, or solitude. Also, they say something about acupuncture. Acupuncture was being practiced also. Even, I think I'm going to quote you, Monique, for saying that maybe getting out of the social media, Facebook, or lessening the amount of time that you're in there. Another one is learning how to say no, especially culturally, because most cultures, we try to be very passive and we don't want to say no because we don't want to hurt people's feeling or our family's feeling. And sometimes that's not good, because then we overwhelm ourselves and we have to take care of ourselves first before we can take care of others. One other thing that one of the good things that I took note from is somebody said, I think it was Patricia, you cannot give to others if you do not have anything else to give. So that's what are the things that I noted. And one of the things also is each one is unique, because we have to do what works for us. I mean, everybody will have different kind of self-care, because it's definitely need to be customized to your needs and in what space and time you are in. Let me see. I think one of the other quotes, the one that I share, is that we have to realize that we have two lives, and the time that you are starting your second one is the time that you realize you only have one. That's one of the other quotes that we did share. And I think, and then also the last note was that we need to revisit the things that worked for us before, because sometimes it will work again if we redo that. All right. Thank you. I think that's it.
Thank you so much. I could have not remembered all of that. So you took great notes. Thank you.
Thank you, Monique, and thank you, Josie, so much. Last but certainly not least, Danita, would you be able to talk a little bit about what folks talked about in the mental health group?
Sure. We primarily spoke about and touching on all of the questions that were given. We we felt like health and wellness was supported through our employers, and making sure that we have an open line of communication with our employers, and given that we do this line of work, a lot of our employers know the toll that it takes on us as community health workers, and most of them do have an open door policy when it comes to our mental health and wellness. And just being able to talk to our employers and say, hey, I need a minute. I need to talk to somebody. I need to sit down. Can you help me work through this? Whether it's a situation you're going through with your client, or is a situation you're having yourself. So that's a very important aspect of doing this work. Just having a lot of support with your employer, and having them to be on your team. And we talked about what can be done to, I guess, contribute to your wellness. And one of our speakers stated that making sure that her home was conducive to rest and relaxation, so that when she comes home, that's the place that she goes for her tranquility. That's where she goes for her sanctuary. That's where she goes to relax and medicate and just debrief and remove her mind from all the tasks that she's had during the time that she spent at work doing the work of a community health worker. And I thought that was very good. So she explained that that's why she doesn't like to work at home, because that's her relaxation. And so I definitely agree with that. But during this day and time, you know, some of us can't help but to work from home. So we have to find other means of creating a space in our homes or around our homes, in the backyard even, that can prove to be a space that we can go into to help us get through the day. Someone also mentioned coloring and drawing and playing music, meditation music, to help them to de-stress. Seeing all the colors in the coloring book helps them to de-stress and just relax their minds and things of that nature. So I thought that was a very good suggestion. Also, Mr. Escalar mentioned doing his spiritual work and going into meditation to help him to de-stress, to refocus his mind, to help him to relax. And that's also a good way to contribute to making sure our mental health and wellness stays intact. So thank you for that. Also, physical activity. One of our speakers mentioned playing tennis. She likes to play tennis. Actually, two of them, they like to play tennis and get those feel-good endorphins going. And that always helps keeping your body moving, making sure you're drinking enough water, you're staying hydrated, you're staying healthy, eating the right foods, also contributes to a healthy mind and a healthy spirit. All of that works together. So we got to make sure we're eating, exercising, and so that everything is working together. So I definitely love the fact that we are wanting to integrate physical activity into our wellness routines is very important. And taking time to debrief once a week with our employers is very important. Even if we can't debrief with our employers, maybe, you know, seeing a counselor or a therapist, or even someone you trust to talk to. You know, someone you know you can call that you trust, you can talk to. Hey, I need to debrief. And you know, get some things off of your chest. Someone you know who will understand, give you some good advice, or just be a listening ear matters a whole lot in this line of work. So I was very thankful to get the feedback that I did in our breakout room. So thank you guys for that.
Thank you, Danina. I know we're going over time already, so I want to thank everyone for coming here today, for putting your trust in us to have this discussion around mental health and self-care. We know it could be a difficult one for so many. I want to give a big shout out to all of our CHW leaders. Thank you to Danina and Lucy and Lucia, to Rosa. Really big thank you to all of our special guests, to Monique, to Enrique, to Elena, and I know I'm missing some, to Venice, to Edna, TNV, a big shout out. Thank you so much. Please, before you go, if folks have other things that they would like to see from us around self-care or other topics they'd like to do in these learning collaboratives, please let us know or reach out to us at info@nachwa.org. Also, big shout out to all of our new staff who came and supported the learning collaboratives, to Michaela and Josie and Angie, Nina and Nashia, and of course, Denise. Thank you, Denise, for all you do for all of us. Our learning collaboratives are going to be back. We're going to be doing more of these. I really appreciate how everyone took time out of their busy days and schedules to come be with us. We will be putting out more content around self-care and mental health. So we hope to see you all very soon. Michaela, Denise, any of our leaders, any final thoughts before we end today?
I used to begin every call saying that I pray all is well with you and your family and your community. I want to thank you for creating this community with us. I'm very emotional right now. I wish that I could wrap my arms around each of you and just honor the work that you're doing. So I hope that you feel the heart of what we are doing. I hope that we have extended that into your office, into your homes, into your space. We intend to continue and honor this work and to honor each of you. You've taught us so very much, and you are worth it. I think I just want to say that, as frail as you may feel you are, as limited as you may feel you are so worth it. The protection, the restoration, the nourishment, the rest, the joy, the peace. And as we believe we are worth it, if we can see that for others as well, we will be transformative. And so I pray you extend that grace to others, that they are also worth it in your meetings, in your interactions. Thank you again. Aurora, thank you for making this happen. And I pray that all is well with you. Stay safe, each and every one of you.
Thank you, everyone.